The government and NHS leaders have made it a top priority to cut elective care waiting times. But today's numbers paint a mixed picture. Despite prioritising the service, overall waiting lists have reached a new record of 7.33 million. That's up 110,000, the biggest month-on-month increase since August last year. A key NHS target was to eliminate 18-month waits by April. That has been missed, but they are getting close. In September 2021, there were almost 125,000 patients waiting a year and a half. That is now down to almost 10,000. Half of those remaining are at just 10 NHS trusts. The NHS says part of the reason for missing targets is the unprecedented industrial action seen over the past 6 months.
We've had to reschedule around 500,000 appointments over the period of all the industrial action that has taken place. But the important thing about today's figures is that thanks to the hard work of NHS staff, we have reduced the number of people who've been waiting more than 18 months for treatment by 90%.
There is also some good news for cancer services. The number of people waiting more than 2 months to start treatment is down to almost a third, compared with more than 41% in February. But before 2019, that figure had not exceeded 17%. There is also an alarming rise in children's waiting lists. While 18-month waits are continuing to be reduced, the number waiting for a year are at the highest since records began in April 2021. The figures have amplified calls for the urgent release of a long-awaited workforce plan, with trust leaders warning that without it, the NHS will continue to struggle to meet ever-growing demand with too few staff.